Assalamu alaikum. Thank you to the Mosque Committee and yourselves for being present here today and giving me the opportunity to inform you about the services offered at Grooteskier Hospital for our patients diagnosed with breast cancer. I would like to dedicate this talk to our patients who impress me and humble me every day with their dignity, with their courage. So I just want to reiterate and emphasize what was said by Dr. Gajan before. It's not only ladies who develop breast cancer. So alhamdulillah, I'm very happy to see the men here as well. It's not as common as in ladies, but it's definitely not a symptom that should be ignored in men. So I would just like to talk to you about what services are offered in the state sector at Grooteskier, as we know that the majority of the people living in the Western Cape, they cannot afford medical aid and they have to attend the state services. About 86% of the people living here, who we see every day, they cannot afford medical aid, and we see them in the state sector. As Dr. Gajan has gone through so beautifully all the symptoms that are suggestive of breast cancer, I think they're quite important, so I'm just going to go through them one more time. Who should attend the clinic? Anyone who has a lump in the breast or the armpit. The tail of the breast can be found in the armpit, so that is why it's important. It's not just your breast or your chest wall, but also your armpit. If you've got any change in the skin around the nipple or discharge from the nipple, it's important to go and see a doctor. If the skin dimples, as Dr. Gajan has mentioned, or your nipple retracts, that means it pulls back in when it was always out. If there's an unusual increase in the size of one of your breasts, I'm sure you'll notice that. It's important to go. Any asymmetry, as Dr. Gajan has pointed out, get to know your body. And if something has changed, better just check that there isn't something to be concerned about or a diagnosis has to be made. The clinic at Grooteskier Hospital, it's located on the G floor at the surgical outpatients. It's a walk-in clinic. That means you can come there without a letter. We usually like a letter because we would like to write a letter back to your doctor, just telling them what has happened to you. Most of you will have GPs, or if you attend the day hospital, you've got a medical officer at the day hospital who looks after you for other illnesses. So usually if we have a letter, we've got someone to write back to, but it's not essential. Please come, even if you don't have a letter. What else do we offer? We've heard about screening. Dr. Gajan has incredible presentation on the importance of screening. This clinic, G floor, surgical outpatients at Grooteskier, we can also offer screening. It's a way for you to get an appointment for a mammogram. Dr. Gajan has gone through the importance of mammograms after the age of 40. I would just like to emphasize that. And then high-risk populations, those families that with inherited risk of breast cancer, this clinic is your portal or your entry for genetic counseling. We've got a genetic counseling service so that different members of the family can also attend and your risk can be assessed. Who else has high risk for breast cancer? Anyone that has had radiation therapy to the chest before, these are children or young adults that have required radiotherapy as treatment for other illnesses, other cancers. If you've had breast cancer in the one breast, the other breast is at risk to develop breast cancer, and this risk is higher than your average population. The Friday clinic will see up to 80 new patients every Friday. So sometimes you'll come and there'll be 80 people. So, but if you aren't seen that week, we will make a plan to see you the following week. So what's going to happen to you when you come? There'll be a surgeon who will examine you. He'll examine your chest, your armpit, and your neck. They will send you for a mammogram. If there's any lump or any area that we feel needs a biopsy will be done on that day. There'll be 2 types of biopsy. There'll be a thin needle and a thick needle biopsy. The same day, you'll get the results of your mammogram and also the results of the thin needle biopsy. Anybody with a suspicious result on the thin needle and the mammogram will be referred to the oncologist. The oncologist will do an history and examination, getting all your past medical history and examining your whole body thoroughly. And then you will return a few days later to confirm the results of the thin needle and the thick needle biopsy. Once the diagnosis of cancer is confirmed, further tests will be done for what we call staging. Now, the staging is to check if the cancer has spread to any other part of the body, and that will help us decide what's the best treatment for you. The tests that can be done can be a chest X-ray, a bone scan, which is a test that checks all the bones in the body, a CT scan of the chest and abdomen, and there's another test that we do to check if any glands under the arm are involved. It's called a sentinel node biopsy. Maybe some people in the audience have had that procedure before. Essentially, it's putting a radioactive dye into the growth and checking under the arm where this dye is taken up and removing that gland under the arm. The reason we do this is that if that is clear, we can spare you a further operation under the arm of having all the glands taken up, because doing that increases the risk of the arm swelling up. I'm not going to talk a lot about treatment, but I think it's quite important to know that the treatment that you're offered is dependent on the stage of your cancer. We call stage 1 and 2 early breast cancer. That means that the cancer is less than 5 centimeters and may or may not have spread to some glands under the arm. Stage 3 would be a cancer that's more advanced. Cancer is more than 5 centimeters where it started, and up to 10 glands might be involved under the armpit. Stage 4 cancer means that the cancer has spread to other parts of the body, which is generally the more serious and often not curable type of breast cancer. Often we see very young patients who have not completed their family. Dr. Gajan has spoken to you about the fact that people in their 20s and their 30s can have breast cancer. And we do offer a service where we can harvest any eggs from the patient and keep it frozen until the patient is better and wants to use it in the future. Unfortunately, this is not a free service. There's a fee up front and an annual fee after that for freezing the eggs, but that is possible if you have not completed your family and you would like to have a chance in the future and to use the eggs that have not been exposed to chemotherapy or any other treatment. We see about 500 new patients every year in our clinic, and we have what we call a multidisciplinary approach. That means it's just not one doctor looking after you. There's a whole team of people that comprises the surgeon who will do the biopsies to make the diagnosis, and also your operation, whether you need to have the lump or the tumor removed or the whole breast removed or glands under the arms removed. The radiologist, who's a doctor, who will check your mammogram, your CT scan, or any x-rays that you have done. The nuclear medicine doctor that will check the bone scan. The oncologist, who will administer the chemotherapy and the radiotherapy. The social worker to provide support. Many of our patients are not able to work. We need to negotiate with their employers that they receive sick leave. Some of them are unemployed. They need to access the state services for disability grants. Also the dietitian. Often patients who are having treatment don't eat enough, and we need to make sure that they take care of their nutritional needs. The physiotherapist, because of problems with the arms that can develop, to help minimize the swelling. We also have occupational therapists that, due to any consequences of treatment, patients need to use aids for walking or any other assistive devices or any changes that needs to be done at home to help them be more active and live independently. Then there's the psychologist and the psychiatrist. This is scary, not only for the patient, but also for their family. And we have that service to offer the patients where they can be referred to the psychologist and psychiatrist. It is a difficult time, especially if there are children involved. So we'd like to support our patients as fully as we can. Then there's the nursing staff who will administer the chemotherapy and who looks after our patients in the clinic and in the wards. And then the radiation therapists, those lovely people that help you during your radiation therapy. So it's really a team effort in treating someone with cancer. Treatment is usually dependent on the stage, which I've gone through, and it's usually a combination of surgery, chemotherapy, radiation therapy, and hormone therapy. Once the treatment is completed, follow-up is done for every 3 to 4 months for the first few years, and then 6 monthly, and then annually. And after that, we usually refer our patients to their GPs or to the medical officer at the local day hospital who looks after them. I would just like to say in conclusion that the monthly self-examination, as illustrated by Dr. Gudgeon, is very important. An early presentation, if you're worried about anything, to the health services. All of you have now been informed about the walk-in clinic, so there's really no excuse not to attend. And it's essential to detect cancer early because there is curative treatment available, and it does not have to be a death sentence, as has been said before. Thank you for your attention and for giving me the opportunity to address you. Assalamu alaikum.